Hello. Colon cleansing can play an important role in a preventative program for good colonic and general health. Those who are proactive in seeking information, adopting a healthy diet and lifestyle, using screening facilities, and practicing prevention will considerably reduce the risk of becoming a victim of bowel cancer. Please access more free information on health from www.forhealthanddiet.com. That's spelled number 4 HEALTHNDIET.com. Also by emailing healthanddiet-info@yahoo.co.uk. Colon cancer, also known as colorectal and large bowel cancer, is the third commonest form of cancer. In 2008, over 100,000 colonic cancers were diagnosed in the US. Sufferers are predominantly from the developed world. The 50% survival rate for colon cancer improves with early diagnosis. Although the mortality rate has decreased in recent years, probably due to better colon screening programs, carcinoma of the colon remains a dangerous threat to longevity. Cancer is the process and consequence of cells dividing and multiplying uncontrollably and at a faster than normal rate. The mass of tissue formed by the growth and collection of those abnormal cells is known as a tumor. A tumor that enlarges but stays in one place is referred to as benign. When those cells break away from their original site, begin to invade other organs, and continue to grow in the same uncontrollable way, the tumor is then categorized as malignant. This abnormal cell propagation is known as metastasis. Malignant tumors are very often seriously life-threatening, causing death, sometimes very soon after diagnosis. Screening and prevention are crucial in the drive to reduce colorectal cancer mortality rates. Signs and symptoms of colonic cancer are blood and mucus in the stools, persistent diarrhea or constipation, unexplained abdominal pain or swelling, weight loss, fatigue. Although there may be other causes for the above signs and symptoms, it would be sensible to seek medical advice to elucidate causality. What are the causes of colon cancer? Well, 80% of sufferers are in the 60-plus age group. Diet plays a contributory role in bowel cancer. For example, excessive consumption of red meat may increase the chance of developing colon cancer. On the other hand, a diet consisting of oily fish, fruits, vegetables, and fiber-rich foodstuff reduces the likelihood of developing colon cancer. Heavy smoking and alcohol drinking are also thought to be possible causes. Obesity and being overweight are among the suspected culprits. Those from a family with a history of bowel cancer and having previously suffered from polyps seem to fall in the higher risk group. Lack of exercising appears to be linked to the incidence of the disease. Inflammation of the lining of the intestinal tract is thought to predispose it to carcinoma. Ulcerative colitis, Crohn's disease, may increase the risk of developing bowel cancer. Colon cancer is treated by surgery, which is the most used method of treatment. Chemotherapy is an add-on, post-surgical and palliative option. Radiotherapy is used in selected cases. The results from screening programs have been encouraging. There is an 80% chance of treatment being successful when the disease is detected early. Regular bowel checks reduce the mortality rate by 16%. The UK's National Bowel Screening Programme aims to offer everyone in the at-risk age group a fecal occult blood test by 2009. Sigmoidoscopy and colonoscopy are other detection and diagnostic tools that should be promptly considered if any of the above signs and symptoms is experienced. Prevention is better than cure. We can all make a very significant contribution to reducing the risks of becoming a victim of colon cancer. Starting a healthier diet, taking up exercise, paying attention to our weight and waistline, reviewing drinking and smoking habits are steps that the sooner we can action, the lesser will the risks of succumbing to carcinoma of the bowel be. It has been said that death starts with an unhealthy colon. A colon that is not evacuating properly becomes impacted with decaying matter. Harmful toxins accumulate in the bowels and are absorbed into the bloodstream. Parasite infestation, infection, inflammation, ulceration and tumours are other possible developments within a dysfunctional colon. A healthy colon is absolutely essential to prevent ailments that may create a medium for the development of cancer. Inflammation of the lining of the intestines has been linked to tumour formation. Colon cleansing, because of its capacity to prevent inflammatory conditions, is therefore certainly worth including in a preventative plan for good colonic and general health. Colon cleansing is a detox treatment that rids the colon of toxins that can be absorbed in the bloodstream, damaging parasites, pathogenic mucus, and clogged up decomposing matter that can cause constipation. Colon cleansing, as well as contributing to the prevention of bowel cancer, may also be beneficial to weight loss, irritable bowel syndrome, bloating, flatulence, halitosis, hypertension, sinus problems, backache, headaches, hemorrhoids, insomnia, and skin conditions. The detoxifying effects of colon cleansing produce a feeling of well-being and vitality, as more energy is derived from the better absorption of food nutrients through the cleaner intestinal wall. Awareness and being proactive are two important ingredients in the prevention of carcinoma of the large intestine. For more free information on how you could take preventative measures to protect your health, please visit www.forhealthanddiet.com, spelt number 4, HEALTHNDIET.com. Also, free articles on personal health are available by emailing healthanddiet2-info@yahoo.co.uk and write health in subject. Finally, please be advised that information contained in this video is not to be interpreted as medical advice. Consult a professional and qualified medical practitioner before engaging into any action that you may consider taking. Good health, and thank you for sharing some of your time with me.